Welcome back to Senior Stop. I'm Mary, and I'm so glad to be with you in this warm space today. Have you ever gone through days where you just don't feel right? Maybe it's a vague sense of anxiety tightening in your chest when you wake up. Or perhaps it's a persistent, hard-to-name sadness that shows up in the late afternoon. We often try to brush it off, telling ourselves, I probably just didn't get enough sleep, or worse, we believe that little voice in our head that says, I'm weak, or this must just be a normal part of getting older. But what if I told you that those feelings aren't just in your head? What if they are deeply connected to the world around us? From the numbers on our utility bills to the stressful news we watch daily, and even the very air we breathe. What if I told you that your anxiety is a completely rational response to a complex world? Recently, at a major brain and mind conference, the Aga Khan University's Brain and Mind Conference, leading global experts emphasized one thing. They said, we can no longer look at mental health as a standalone, isolated issue. Mental health is multi-layered. It's like a tapestry woven from many different threads. It's not just the chemicals in our brain. It is our finances. It is our environment. It is our social connection. In today's video, we aren't going to offer empty platitudes. We are going to unpack these real causes based on what the experts themselves are discussing. And most importantly, we will explore holistic, easy-to-apply at-home solutions supported by medical research from top universities. Let's explore this together. The first and perhaps most unspoken factor in a doctor's office is this: economic stress. At the conference, one expert, a former Minister of Health, Dr. Zafar Mirza, said something profound. He said, it is impossible to separate economic hardships from psychological suffering. For so many in our Senior Stop community, this is a daily reality. We've worked hard our entire lives, and now we are trying to live on a fixed income or Social Security. But the price of everything else doesn't seem to be fixed. The price of groceries, the power bill, and most frighteningly, the cost of health care and prescriptions. It's a silent burden, a number constantly running in the back of our minds. This is not an imagined feeling. This is biological. Studies from prestigious institutions like Harvard Medical School and the Mayo Clinic have repeatedly shown a direct link between chronic financial stress and elevated levels of cortisol in our bodies. Cortisol is our stress hormone. A little bit is fine, but when it's constantly high, it wreaks havoc. It disrupts sleep, raises blood pressure, weakens the immune system, and yes, it leads to depression and anxiety. So when you are worried about how to pay an unexpected medical bill, you are not overthinking. Your body is responding to a real threat. So what is the solution? We can't change the whole economy, but we can reclaim a sense of control. The first solution is micro-budgeting. Sometimes looking at the entire yearly budget is terrifying. Instead, focus on this week, just this week. What meals can you control? What small spending can you cut? Reclaiming control over small things sends a powerful signal to your brain, lowering cortisol. The second solution is proactive resource tapping. Don't wait. Organizations like AARP or the Centers for Medicare and Medicaid Services, CMS, have countless programs for cost assistance and prescription discounts. Make the call. The act of making that one phone call, an act of agency, helps you feel like the driver, not the victim. Taking control of your finances, even in small ways, is mental health care. The second factor the conference addressed is one we probably wouldn't have linked to mental health 10 years ago. It is climate change. It sounds massive, doesn't it? But think about it. For seniors, this has two very real impacts.
First is the physical vulnerability. We know that our bodies, as we get older, have a harder time regulating temperature. A severe heat wave isn't just an inconvenience, it's life-threatening. More intense storms, longer wildfire seasons, we feel that fragility. Second, and perhaps more profoundly, is what psychologists are now calling eco-anxiety. It's the worry we feel when we look at the world and wonder, what kind of world are our grandchildren inheriting? We've built our whole lives, and now we worry about the very foundation of our shared home. And again, this is not you being overly sensitive. The American Psychological Association has officially recognized eco-anxiety as a real phenomenon. It's defined as a chronic fear of environmental doom. It's linked to insomnia, anxiety, and depression. It is a rational response to the alarming changes we are witnessing. So what do we do with a problem so large? The feeling of powerlessness is what fuels the anxiety.
The first solution is micro-action. Just like micro-budgeting, take micro-actions. Turn off lights when you leave a room. Recycle meticulously. Plant a few herbs on your windowsill. These actions in themselves may not save the planet, but they save your mind. They replace the feeling of helplessness with a feeling of purpose. The second solution is grounding. Studies from Stanford University showed something incredible. They found that people who took a 90-minute walk in a natural setting, like a park, had decreased activity in the prefrontal cortex, the part of the brain associated with negative, repetitive thoughts. If you can't walk, just sit on a park bench, touch a leaf, feel the sun, reconnect with the earth instead of just worrying about it. We've talked about external factors. Now let's talk about solutions from within the healthcare system. One of the strongest messages from the conference, highlighted by Dr. Asma Humayun, is that single-tier solutions don't work. We cannot just rely on waiting months to see a specialist. Mental health needs to be integrated where we go most often, our primary care provider's office. Most of us have long-term relationships with our PCPs. We trust them to check our blood pressure, manage our diabetes, and prescribe our arthritis medication. But there is a stigma that still exists. We're comfortable saying, "Doctor, my knee hurts," but we are hesitant to say, "Doctor, my soul hurts." This is where we need to change the game, based on solid medical evidence. The collaborative care model, which was pioneered at the University of Washington, has shown incredible results. This model is simple. The PCP, a care manager, and a psychiatric consultant work as a team for you, right in the PCP's office. Studies show that, especially for seniors, this model doubles the recovery rate from depression compared to standard treatment. But you don't have to wait for your clinic to adopt this model. You can start now. The at-home solution is prepare for the courageous conversation. The next time you have a doctor's appointment, don't just focus on the physical. Before you go, take a piece of paper and write down 1. How is my sleep then? 2. Do I still find joy in the things I used to love? 3. Have I been feeling hopeless or worried often? Give that paper to your doctor. Say, "Doctor, I know we're watching my blood pressure, but I want to talk about these things too." You are giving them the information they need to help you holistically. You are bringing mental health out of the shadows and placing it firmly in the exam room. Finally, another multi-layered solution comes from a place that might be surprising: technology. Experts at the conference, like Dr. Sharik Hoja, spoke about empowering health workers with digital tools, but this also applies to us. I know technology can be intimidating. These smartphones sometimes seem far too complicated, but they can also be a lifeline. During the COVID era, we saw the explosion of telehealth.
For seniors who have mobility issues, the ability to talk to a doctor or a therapist from their own living room is revolutionary. And it goes beyond that. Studies from the MIT Age Lab have looked at the impact of technology on senior loneliness. They found that simple things like online support groups, where you can talk to others going through the same thing, or simple meditation apps, can significantly reduce feelings of isolation. The solution here is start very small. You don't need to become a tech expert. Try one thing. Ask a grandchild to install a free meditation app for you, like Calm or Headspace. Just 5 minutes a day of listening to a soothing sound. Or make a commitment to use FaceTime or Zoom once a week to video call a loved one. Seeing their face, not just hearing their voice, activates different parts of our brain related to connection. That is mental health care. So, my friends at Senior Stop, our mental health is not an island. It is part of a complex ecosystem. It is affected by our wallets. It is affected by our planet. It is affected by how we interact with our medical system. The next time you feel anxious or low, please remember this. What you are feeling is real. It is valid, and you are not weak. You are simply a human being living in a complex world. And the good thing is, there are holistic, multi-layered solutions to help us. Now, we want to hear from you. We are a community. Of all the factors we discussed, economic, environmental, medical, which one impacts you the most? And more importantly, what at-home solutions, big or small, are you using to take care of yourself holistically? Please share your stories and your wisdom in the comments below. What you share might just be a lifeline for someone else watching this video. Thank you for spending your time with Senior Stop today. Take care of yourselves and remember to do it holistically. We'll see you in the next episode.